My name is Baillie. I'm the Executive Director of the Mpesa Foundation and I'm a trustee of the Safaricom Foundation. We've been working with AMREF for many years now. Currently, through the Mpesa Foundation, we have 3 ongoing projects with them, looking at healthcare at the basic level, at the community health volunteer, and also looking to see how the mobile technology can be used within healthcare. And one of the big issues that we have within healthcare in Africa, and particularly in Kenya, is the education of the community health workers, the midwives, because with the country being so large, that trying to educate and train these people at the grassroots level is very difficult. So mobile technology can actually greatly enhance the learning capability of the community health volunteer, the midwife, the nurse at the local clinics. So one of the projects that we're co-funding with Accenture Foundation is a project which we're calling HELP, which is Health Enablement Learning Platform. And that is taking the existing AMREF e-learning platform, which was based around the use of computers for learning, and we've taken it onto the mobile phone. And the most basic mobile phone, not a sophisticated smartphone or anything. And what that does, that enables community health volunteers to go through a formal learning process following a specific curricula, and using the mobile phone through SMS, through IVR, through USSD and through voice to actually go through a series of 9 training programs. We've piloted the phase 1 and we've now trained just over 300 community health volunteers. We're now extending that to phase 2, where we're upscaling that to get to 3,000 community health volunteers, and also looking at the application, smartphone application as well. Now we know that we can't do everything using smartphones purely because of the cost, and the average community health volunteer may have a phone, but it's certainly not a top of the range smartphone. So by using our technology and using the existing infrastructure that is there, we can actually reach far more of the health workers at the grassroots level. So AMREF are the implementers on this. They're doing the training of the community health volunteers, they're doing the monitoring. Safaricom is providing the mobile infrastructure, and also Vodafone are looking at, they provide the back-end system which contains all of the scripts for the curricula. And we see that this is a wonderful example where you can run a pilot and then make it very, very scalable. So there's no reason why this system can't train 100,000 community health volunteers in Kenya. It can easily be moved to any other country in the world where there is a mobile phone system and there is a good implementation. So we see this as a great way in which mobile technology and healthcare can start to come together, not for the sake of mobile technology, but purely as a means of getting it to the mass, in effect the mass market, getting it out into the rural areas and getting it down to the grassroots, to the clinics where most Kenyans go for their healthcare. It's important for Safaricom Foundation and the Mpesa Foundation because we see that our technology has to be used not just for creating profits for shareholders, but also for making a huge difference in the country. And healthcare and education, we know, are 2 of the key fundamentals to developing an economy. If you have a well-educated and a healthy population, then economic development will very quickly flow from that. So we see that this is a way of us helping Kenya develop from a developing nation into a mid-wealth nation. And so therefore for us it isn't about necessarily making money, if that happens to as well, that's great. But for us, the issue of healthcare and us using our technology is making it more affordable and more accessible to the population as a whole. Well, on the health program, the first pilot phase, which lasted just over a year, the aim therefore there was to train 300 community health volunteers. That has now happened, and those were in Kibera, in Samburu and in Kitui. The phase 2 will take those 300 and expand it to at least 3,000, so that we can show that the scheme is scalable, because one of the issues around mHealth, where people develop applications using mobile technology, most of those pilots never ever go to scale for one reason or other. With this, we want to show in the second phase that we really can expand that up from 300 to 3,000, and once we've proven we can go to 3,000, going to 30,000 for 300,000 for 3 million is then just scaling up the actual the concept that we've already proved. Healthcare and expanding it and making it more accessible is all about partnerships. AMREF can't do it by themselves, Safaricom can't do it by itself, Samsung can't do it by itself. But if you bring those organisations together to use their own specific skills, their own specific resources, and not duplicate but work together, then that is how we're going to move the healthcare agenda forward, both in Kenya and throughout Africa. And if you look around the whole of the continent, you've got the technology companies, you've got the health organisations, you've got the NGOs, you've got the governments. If we all work together rather than in competition, then I think we can move the healthcare agenda forward very, very rapidly over the next 5 to 10 years.